So pathology is a bridge between basic science and clinical practice, like preclinical and clinical science. So this approach integrated curriculum provides a cohesive learning experience, allowing students to see the direct application of pathology concepts in real world clinical settings. This integration enhances their understanding of how pathology impacts patient care and improves diagnostic and treatment skills.
Welcome to the People of Pathology podcast. I'm Dennis Strank. On this podcast, we explore pathology, laboratory medicine, forensic science, and new technologies in these fields. Active learning methods play a vital role in enhancing critical thinking and problem-solving skills in pathology education. Today, Dr. Ritcha Saxena returns to the show. We discuss a recent study comparing active learning in pathology in the United States and in other countries. We'll talk about some of the key findings from this study, and we'll get an update on some of her other projects. All right, here's Dr. Ritcha Saxena. I know you're up in Minnesota now, so can you talk about that, like what brought you there and how's it going?
I joined the University of Minnesota. I'm in Duluth campus. So it was driven by a pressing need for a dedicated pathology educator there. The position became available due to the retirement of a long-serving faculty member, and the search committee emphasized the challenge of filling this role, as many new hires were gravitating towards clinical practice. They were hiring, and then eventually they were going to Asia for clinical practice because, as you know, clinical practice is much more rewarding monetarily, and for some people, it is more satisfying too. I am basically a pathology educator, and my enthusiasm for pathology education teaching led me to pursue this opportunity. And after being selected, I began my role by engaging with the IHO course, that is hematology and oncology course. It was really nice. As I landed at the very next day, my classes were there for this course. There was warm reception from the course director, an excellent person. And after completing the course, so there was a very positive feedback from students. They give review. So that was a positive feedback. And this made the transition both smooth and rewarding. And then another important thing here in Minnesota, particularly in Duluth, the natural beauty and vibrant culture seen and have greatly enriched my experience here. The four weathers are distinct and pictures setting for outdoor activities, and the welcoming community adds to the overall high quality of life.
Okay, that sounds like you had a great welcome there. I'm curious, what do you think of the winter? Like, I'm in Wisconsin. I thought our winters are bad, but I got to imagine Minnesota's a little bit more cold.
So definitely I was scared of winters because I am
Hmm.
from tropical climate, and I was told that winter is almost like 6 months and temperature goes as low as -20, even -40.
Yeah.
This time it went down to -19 as far as I remember, but it was okay for me. I don't know how come I enjoyed this weather as well because they said this was warmer winters. This was not a true winters, first of all, and then the facilities are very good. So my problem was the ice, the snow, the ice rain, and I slipped once. My glasses were broken, and otherwise the weather is really. The winters are also beautiful for me. This winters I pretty much enjoyed indoor, and I used to go out, but it was fine with clothing and all, except for the when there was ice rain. I mean, the temperature was like a little like -2 or -3, and then the
Hmm.
raining and it covers the. I hope you know it much better than me. So it becomes ice while on the road, and I never knew about this ice.
Oh,
So
sure.
I slept.
Yeah.
Now I will be more careful.
Sounds like the interesting new experience for you. You were on the podcast once before, and that was episode 51, so a long time ago. And but this was during the pandemic. And I remember we talked briefly, you were experimenting with virtual teaching methods. And I'm curious about this. Are you still incorporating any of those methods in your work now?
Yeah, so now I have continued to integrate virtual teaching methods into my educational approach. And these methods so far have proven indispensable for adapting evolving circumstances and addressing the diverse needs of students. So many a times I employ online lectures, then of course with Zoom interactive discussions and virtual microscopy and virtual simulations to enhance accessibility, flexibility, and student engagement. Particularly in the context of pathology education, there has been a notable shift in expectations. It's no longer just about imparting foundational knowledge of disease mechanisms, and it is also about helping students apply this knowledge effectively in clinical settings. So, establishing clear learning objectives and assessing students' ability to integrate and apply this knowledge is essential. Here comes the role of virtual microscopy, which has become an important complement to traditional light microscopy. And by offering interactive and immersive experiences, this enriches the learning process and provides valuable opportunities for in depth exploration. This, combined with traditional methods, creates a blended learning environment that leverages the strengths of both approaches. So, maximizing student engagement and interaction is a key focus. Then, incorporating problem based and case based learning scenarios fosters critical thinking and clinical decision making skills. We can use these all things online as well. So, our evaluations are more now, more on give more emphasis on clinical interpretations and correlations with microscopy, and then red path correlations with radiology and pathology correlations, and aligning more closely with a real world medical practice. So, looking at embracing digital tools and creating a dynamic, interactive learning environment are crucial. This approach ensures that we effectively prepare medical students for the complexities of pathology and equip them with the skills they need for their future careers in healthcare.
Okay, I like this approach. Do you feel like because pathology is such a visual specialty, do you feel like it's particularly suited for some virtual teaching methods?
Yes, so here at the comes in pathology, we have this virtual microscopy that is digital pathology, which we are using for a long time. So they have annotated slides and annotated things so the students can analyze very well online, and virtual teaching is pretty much beneficial for digital microscopy particularly. And we can combine this with traditional methods like a blended learning environment.
Okay, I see. I see. That makes sense. Now, I want to talk about this study that you were part of that actually resulted in a paper being published too. So, this was a study that analyzed the amount and type of pathology education in medical schools, both in the US and in other countries. So, can you kind of take me through how this study, like how it started, how it developed, and how you got involved?
I was directly involved in this study, and in this study all the authors including myself were associated with GRIPE, and GRIPE is a group for research in pathology education. So, this organization focuses on examining and improving pathology education across different medical schools. Now, this is merged with IMC, so still it exists, but not as since it has merged with IMC, so the time is little less. And this study came about as a part of a broader effort to assess and enhance medical education curricula in response to evolving needs in medical practice. Then technological advancements and changes in educational standards. So that's how the study came about. And to conduct this study, we collected and analyzed data from various international and US medical schools. So many of US institutions were involved in addition to international medical schools. This involved a detailed review of curriculum, content, teaching methods, and the allocation of instructional time for pathology. We employed surveys to gather information from faculty and students, conducted comprehensive curriculum reviews, and performed comparative analysis across different institutions. So basically, the goal of this study was to evaluate how well current pathology education equips medical students with the knowledge and skills necessary for clinical practice. By examining the amount and type of pathology education, we aim to identify strengths and weaknesses in existing curricula. This included assessing the balance between lecture based teaching, laboratory work, and active learning strategies such as problem based learning, that is PBL, and team based learning, that is TBL. So, our findings were intending to provide valuable insights into how pathology education could be improved to better meet the needs of students and prepare them for real world clinical scenarios. So, this was the collaborative effort of GRIPE members, and this allowed us to contribute meaningful recommendations to the field of medical education, ultimately aiming to enhance the quality and effectiveness of pathology training across medical schools.
Okay, I see. And I believe the study showed that there were some differences between education in the US and in some other countries. Can you talk about like what were some of the most significant differences?
Yes, definitely pathology education varies significantly between the United States and other countries. And this reflects the differences in curricula and teaching methods. In comparing the total hours spent on different forms of pathology instruction, such as lectures, team based learning, problem based learning, and other methods, we observe some notable differences. So, medical schools outside the USA typically dedicate more hours to lectures in both general and systemic pathology compared to schools within the USA. So specifically, actually, it is a little bit big. The outside schools offer 141 hours of lecture time combined for general and systemic pathology. I'm not including laboratory hours here, while US schools offer approximately 97 hours. Within general pathology, 3 subjects, and within systemic pathology, 6 subjects had significantly more lecture hours outside the USA. Laboratory hours for both general and systemic pathology are also more extensive in schools outside the USA. So, this suggests a greater emphasis on hands on practical learning experiences in these institutions. And now, there are different kind of active learning strategies. So, when it comes to active learning strategies, PBL, that is problem based learning, is used much more extensively outside the USA with an average of 97.2 hours dedicated to this method compared to just 16.5 hours in US schools. And conversely, TBL, that is team based learning, is utilized more in the US. And this was approximately averaging 84.5 hours compared to 59.5 hours outside the USA. If we think of overall medical schools outside the USA integrate more extensive lecture hours, laboratory time, and PBL sessions, problem-based learning sessions into their pathology curricula. However, US school places a great emphasis on TBL. So the diverse approaches reflect different educational priorities and methods in teaching pathology across various regions.
That's interesting. Now, as far as team-based learning and problem-based learning, can you give kind of an example of each one of those so we can get a kind of a better idea of what those mean?
Yes. So the team-based learning, and I can give you with some. Now, let us use a topic for for explanation of team-based learning and problem-based learning.
Okay.
So the team-based learning. To let us take example of, say, for example, bone tumors, which is an important tumor in musculoskeletal pathology for in undergraduate medical education. So if we go for team-based learning, the students start by preparing for class through assigned readings on bone tumors. So we give them a pre-reading for bone tumors, which cover topics such as the types of bone tumors, locations, classification, benign, malignant, molecular pathology, microscopy, gross appearance, radiology, and then the treatment and management options. During class, students first take an individual readiness assurance test, that is IRET. So where individually they are checked. Here there's a quiz on material they studied. Then there is a discussion team-based learning session, like they discuss in team. And after this, they take the same quiz again in teams as part of the team readiness assurance test. In this stage, they discuss their answers with team members to reach a consensus, which helps reinforce their understanding. Here, for the application exercise, each team is given a complex case involving a patient with a bone tumor. This case includes patient's clinical presentation like pain, swelling, and then location, imaging results like X rays or MRI. Because different, as you know, in different tumors have different kind of presentations on radiology, like osteosarcoma have a different presentation, and then how to correlate it with the microscopy. So there are descriptions of the tumor's gross appearance and the microscopic features. So these teams work on several tasks: identifying and classifying the tumor, analyzing molecular markers, correlating radiological findings with gross and microscopic pathology, then integrating clinical data, generating a differential diagnosis, and proposing a management plan. Each team then presents their findings to the class, including their analysis of the clinical presentation, imaging, gross and microscopic pathology, and differential diagnosis and treatment options. Here, our role as instructor, we provide feedback and address any misunderstandings. So this is team-based learning. In problem-based learning, the students begin with a case. Say, for example, a 30-year-old patient has a painful mass in distal femur with X-ray suggesting a bone tumor. The problem is not fully structured. So there's no period and problem is not fully structured. And students work in small groups to analyze the patient's symptoms, signs, and clinical history, and initial imaging findings, and then biopsy findings, of course, that is microscopy. And then if the tumor has surgically been removed, then of course the gross findings as well. So various groups, here also we have various groups, and they research various types of bone tumors, including their locations, molecular pathology, and treatment options. They also investigate the expected gross and microscopic features of these tumors and correlate radiological findings with pathology. For example, they might look into how a tumor's appearance on an X-ray relates to its microscopic structure and how clinical symptoms match the pathological findings. Then different groups have different tasks. Like one group is analyzing the types of bone tumors with locations, and other is molecular pathologies, others microscopic and clinical findings. Then after that, each group presents their diagnosis, clinical, correlating clinical and radiological and pathological data, and then laboratory investigations. And they also discuss a differential diagnosis, considering other possible conditions that might present similarly. And finally, they develop a management plan based on the tumor type and stage. Here, these groups receive feedback from peers and instructors, which helps them refine their analysis and understanding. So, the main similarities between TPL and PBL are that both methods actively engage students in applying their knowledge and integrating different types of information, such as clinical, radiological, and pathological data. Both also involve teamwork and require students to think critically and solve problems. The key differences are in their structure and focus. A TBL has a more structured approach with pre-class preparation and specific application exercise, while PBL, that is problem-based learning, is more flexible and driven by student-led exploration of open-ended cases. In TBL, the instructor guides structured activities and provide feedback on team presentations, while in PBL, the instructor facilitates group investigations and discussions supporting students in identifying knowledge gaps and refining their understandings.
Okay. And going back to what you said earlier, I think you said that problem based learning is more often used outside of the United States, right?
Yeah, we are also using, but I'm just talking about the percentage. So
Mm.
we also use problem based learning and TBL, team based learning both, because without active learning now, traditional methods we no more use as frequently. So, but problem based learning is more in the our survey we found that problem based learning is more prevalent in outside US schools.
Now, the paper that was published about this study, which is called Pathology Teaching in Different Undergraduate Medical Curricula Within and Outside the United States, a pilot study, which I'll link in the show notes as well. Now, it goes through kind of the different types of curriculum, and I think it seems that the integrated curriculum has the most benefits. Would you agree with that? And are there other additional benefits to the other curriculum methods?
Yes, I agree. The integrated curriculum offers substantial benefits by combining basic sciences like pathology with clinical practice. So, pathology is a bridge between basic science and clinical practice, like preclinical and clinical science. So, this approach, integrated curriculum, provides a cohesive learning experience, allowing students to see the direct application of pathology concepts in real world clinical settings. This integration enhances their understanding of how pathology impacts patient care and improves diagnostic and treatment skills. Also, it helps in making understand the pathophysiology behind the disease process so as to implement management plans for the patients. However, while the integrated curriculum is highly effective, other methods are also offer some advantages. So, traditional curriculum is increasingly rare nowadays, although traditional curricula offers a structured foundation through comprehensive lectures, ensuring a thorough grounding in fundamental pathology concepts. However, it has so many limitations, such as fragmentation of knowledge, limited practical application, and reduced engagement. So, these things have led many institutions to move away from the approach. And there is another disadvantage is it requires robust pathology education hours. And the main problem is with retention, how much the student can retain, because mainly it is one-sided. Like basically, there is no active participation in traditional curriculum. Nowadays, active learning strategies, techniques like PBL and TBL provide significant benefits by engaging students actively in solving clinical problems, woven in pathological case-based scenarios, and working collaboratively. So these methods foster critical thinking and problem-solving skills and clinical pathological correlation, which complement the integrated curriculum because of the advantages of these active learning strategies. They are very often incorporated and into integrated curricula to enhance practical application and student engagement. So, in other words, integrated curriculum has an extra advantage that it can very easily incorporate active learning strategies. If we go for another approach is competency based education, which focuses on developing specific diagnostic skills and assessing students based on their ability to perform clinical tests. For example, it ensures the students not only understand pathology, but can also apply it effectively in patient care. Competency based training builds practical expertise and provides targeted feedback, which is crucial for world practice. So, in other words, like there are very limited advantages of traditional curricula, so they are less commonly used today due to their limitations and relying heavily on passive learning. So they are potentially lacking a patient centered focus, mainly relying on pathology, and the connection between the clinical uh, application is very little. As a result, many medical schools have adopted integrated curricula to provide a more cohesive, practical, and engaging learning experience. And of course, this is enhanced by incorporating active learning strategies to better prepare students for modern medical practice.
That makes a lot of sense to me. Developing critical thinking skills, that seems absolutely vital. And, passive learning, you're basically just, I guess, kind of memorizing things, where the active learning, you're actually applying what you've learned to, potentially real world situations, or at least, case studies and things like that. So that makes a lot of more sense to me, that it would be moving in that direction. So that's interesting.
Absolutely.
You're listening to the People of Pathology podcast with our guest, Dr. Ritcha Saxena. We'll be right back. If you think it would be nice to have a helpful reference about digital pathology, I have some great news for you. Dr. Alexander Zhurdov has written a book called Digital Pathology 101, all you need to know to start and continue your digital pathology journey. This book will help you whether you're a complete novice or a digital pathology trailblazer. You can get a copy of it by following the link in the show notes. LabVine is an interactive online learning platform where laboratory professionals learn, develop, and discover by sharing knowledge and building on each other's experience. The platform provides global access to internationally accredited laboratory-specific courses and other resources developed by lab specialists, like us, for the laboratory industry. LabVine is free to sign up, and you can use the link in the show notes to get started. And now for the rest of my conversation with Dr. Ritcha Saxena on the People of Pathology podcast. Something else from the paper, it mentions the 2010 Carnegie Foundation report. And can we talk a little bit about this? Like, what was that? And I know there were, I think, 4 recommendations that came out of that. How did pathology education as a whole respond to it?
So the 2010 Carnegie Foundation report, that is Educating Physicians, a call for reform of medical school and residency, this provided a critical assessment of medical education in the United States and proposed significant reforms. This was authored by, I think I remember, like Patricia Benner, Molly C. Toll, and Carmen M. Sheets, and many others. So these were the main authors. And this report aimed to address the disconnect between medical education and the practical demands of modern medical practice. One of the report's key findings was the fragmentation between basic sciences and clinical practice. It recommended integrating basic sciences such as pathology with clinical training to create a more cohesive and relevant curriculum. Again, the idea was to bridge the gap between theoretical knowledge and practical application, allowing the students to better understand how pathology concepts are applied in clinical settings. The report also highlighted the need for patient-centered approach to medical education. It suggested that curricula should reflect the complexities of patient care and emphasize the practical application of medical knowledge. This shift aims to better prepare students for real-world interactions and decision-making, ensuring that their education is directly relevant to patient care. Active learning strategies were another major focus of the report, and traditional lecture-based teaching was criticized in favor of more interactive methods like problem-based learning and team-based learning. These methods encourage critical thinking and problem-solving skills, aligning learning experiences more closely with clinical practice. In this report, competency-based training was also emphasized. The report advocated for assessing students based on their ability to perform specific clinical tasks and make diagnostic decisions, ensuring that they acquire the practical skills needed for effective medical practice. Additionally, the report called for systemic changes in residency programs and continuous professional development, emphasizing the need for training that evolves with advances in medical science and addresses the dynamic needs of patients and the healthcare system. So The main question is how pathology education responded to it.
Hmm.
So let me brief up something about that also. In response to these recommendations, pathology education has undergone several significant changes. Pathology content is now more integrated with clinical training. For example, medical schools incorporate pathology modules into clinical rotations and case based learning. Students might study cancer pathology during their oncology rotation, applying their knowledge to real patient cases. This integration helps them understand how concepts like tumor staging and histological findings impact diagnosis and treatment decisions. The curriculum has also shifted towards patient centered learning. Pathology programs now emphasize how understanding disease mechanisms affects patient outcomes. For instance, students might examine case studies of patients with various infections, seeing how pathology informs the diagnosis and treatment of these conditions. Active learning strategies such as GBL and PBL have been implemented in pathology courses. These methods involve students working in groups to analyze case studies, interpret laboratory results, and propose treatment plans. This approach engages students in solving complex clinical problems, fostering critical thinking and problem solving skills. Competency based education has become a focus in pathology programs, developing specific diagnostic skills and assessing students on their ability to make accurate diagnosis and apply findings to patient care. This approach ensures that students are well prepared for real world medical practice. Furthermore, pathology education has increasingly embraced horizontal and vertical integration. So, horizontal integration involves embedding pathology throughout various stages of medical curriculum, linking it with other preclinical subjects like physiology, anatomy, pharmacology, biochemistry. So, this is horizontal integration. For example, cardiovascular pathology might be taught alongside with cardiac physiology, what are the biochemical changes, as well as what is the anatomy of the heart and function of the heart, helping students connect pathological concepts. Also, side by side, this is taught just alongside cardiology so that the pathological concepts can be easily correlated with clinical symptoms and treatment plans. Vertical integration ensures that pathology education builds upon itself through medical training. So, foundational concepts introduced early are reinforced and expanded upon during clinical rotations. For instance, students might first learn about basic disease mechanisms and laboratory techniques in their preclinical years, and then side by side, they learn to apply this knowledge with the clinical case based learning scenarios, and then that's how they can apply this knowledge during internal medicine or surgical rotations. This continuity helps students understand the progression from basic science to clinical application, enhancing their competence in patient management and decision making. So, overall, these changes in pathology education reflect the Carnegie Foundation report's recommendations, aiming to create a more integrated, patient centered, and practical learning experience for future physicians.
And it seems like the pathology education response to it, it brings pathology because it's so integrated with other specialties. It kind of raises the importance of pathology to where I'm sure, we both think it should be. But yet it like the study shows, the medical schools outside of the United States tend to have more hours of pathology education than medical schools within the US. Why do you suppose that is?
So, as we know, like medical school curricula has evolved, yet the rapid expansion and complexity of laboratory tests, particularly advanced tests like genetic text testing since the early 2000s, and even the routine testing sometimes have not been matched by an equivalent increase in pathology training. Medical students often receive insufficient education on when and how to order and interpret the routine and special tests. Consequently, graduates heavily depend on anatomic and clinical pathologists and radiologists to interpret results while struggling to select the appropriate test for an ever growing array of complex and costly assays. Currently, many institutions lack integrated systems to support physicians and clinical laboratory tests, unlike the routine review processes found in anatomic pathology and radiology. This disparity in support creates significant gaps in education, leading to potential diagnostic errors. Despite the advanced capabilities of modern laboratories, including whole genomic sequencing, many clinicians remain ill equipped to properly assess complex test results. And at times, as simple as PTT, that is prolonged partial thromboplatin time, or elevated anti-nuclear antibody levels. So they are ill-equipped even for these tests. This disconnect often results in severe unrecognized diagnostic errors, as clinicians may not seek necessary advice on laboratory-related issues, leaving critical problems unresolved. And very often I have observed, and many have observed, that in high-pressure environments such as emergency departments, ERs, intensive care units, ICUs, and operating rooms, these gaps in pathology education have particularly dire consequences. ER physicians faced with urgent and life-threatening situations need to order and interpret test results swiftly and accurately. Insufficient training can hinder their ability to make timely decisions, potentially delaying interventions and impacting patient outcomes. Similarly, ICU physicians must interpret complex test results to manage critically ill patients effectively. Inadequate pathology training can lead to delays in diagnosis and treatment, compromising patient care. Surgeons reliant on intraoperative pathology consultations and rapid test results may struggle with interpreting these results in ordering specific tests, affecting surgical decisions and patient outcomes. So, addressing these educational gaps through enhanced training and support is crucial. Improving pathology education can empower physicians to handle these complexities of modern medical practice more effectively, leading to better patient care and reduced diagnostic errors. So, to bridge gaps in pathology education and undergraduate medical schools, several key recommendations can be implemented. First of all, increase curriculum hours and integrate content by expanding the number of hours dedicated to both anatomic and clinical pathology, ensuring comprehensive coverage. Pathology education should be embedded throughout the medical curriculum by integrating it with other subjects such as physiology, pharmacology, and even in clinical rotations. Horizontal and vertical integration are crucial, but it's also important to increase the total hours devoted to pathology. Secondly, I think enhanced training in laboratory test selection and interpretation by providing detailed instruction on routine laboratory tests, including their selection and interpretation, is important. Practical exercises such as case-based learning and interactive problem solving should be used to give students hand-on experience in ordering and interpreting these tests. Develop support system for clinical decision making by creating institutional systems that offer automatic support and consultation for interpreting complex laboratory tests. Clinical decision support tools should be integrated into electronic health records to assist with test selection and interpretation. Strengthening interdisciplinary collaboration by encouraging cooperation between pathologists, clinicians, and educators to develop and deliver relevant pathology content is also very crucial, as well as active learning approaches, such as team based learning and problem based learning, should be utilized to teach pathology and promote practical application of knowledge. We should also emphasize laboratory tests in high pressure environments by incorporating active learning strategies like TP and PBL with clinical case based learning scenarios. from the very early inception, particularly focusing on high pressure settings such as ERs, ORs, and ICUs. So we can develop these kind of cases that they can differentiate on differential diagnosis, and they can create like emergency room settings or ORs. And case-based learning should replicate high-pressure situations to enhance decision-making skills in critical settings. We should also ensure regular curriculum updates by keeping the pathology curriculum current and the latest advancement in diagnostic technology and clinical practices. Mechanisms for ongoing feedback from students, colleagues, educators, pathologists, and pathology assistants, and other lab professionals should be implemented to continually refine and enhance pathology education program. Then evaluation and assessment of competencies is also very crucial, and we should evaluate and assess competence by developing comprehensive assessment tools to evaluate students' abilities in laboratory test interpretation and clinical decision making. Incorporating case studies and interactive problem solving scenarios into assessments will test students' skill in handling complex diagnostic situations effectively. And I think these recommendations can improve pathology education by focusing on practical skills, decision making abilities essential for modern medical practice.
Yeah, but as you just said, those recommendations are very practical, and they're going to improve pathology education and ultimately patient care, right?
Yeah.
Yeah, exactly. So the last thing I wanted to ask you about is what's next for you? What kind of like new projects are you working on?
So currently, I'm working as senior affiliate faculty at CIH, University of Minnesota.
Mhm.
That is Center for Interprofessional Health. So I am deeply involved in integrating pathology into interprofessional education. And this role allows me to collaborate closely with diverse healthcare professionals, fostering a comprehensive understanding of pathology's role in clinical practice across disciplines. As an educator, I strive to facilitate meaningful learning experiences that emphasize the importance of pathology in diagnostics, treatment, planning, and patient care. This approach not only enhances interdisciplinary teamwork, but also prepare future healthcare professionals to deliver holistic and effective healthcare. Additionally, I am actively engaged in writing a comprehensive manual on AI and its transformative impact on medical education, which has been accepted for publication by Springer. So I think like the last chapter will be completed by the early 2025.
Okay.
And this book will serve as a practical guide for medical educators, exploring how AI technologies can optimize teaching methodologies and enhance learning outcomes. From personalized learning paths to simulated patient interactions and data-driven insights, AI offers unprecedented opportunities to equip students with the skills and knowledge needed to navigate complex healthcare environments. By integrating AI into medical education, this book aims to prepare future healthcare professionals to harness technological advancements effectively and deliver patient centered care. Last but not the least, I am dedicated to fostering inclusive spaces and promoting equity while working as a DEI coach at Duluth campus and promoting equity in interprofessional health education. I am dedicated to fostering inclusive spaces and promoting equity. And I am also honored to be an elected member of the DEI Council, where of Twin City, that is in University of Minnesota DEI Council. And here I was involved in contributing to shaping policies and initiatives that advance diversity, equity, and inclusion across the campus. My research focuses on DEI in health professionals' education, exploring strategies to create inclusive learning environments. In March this year, I had the privilege of presenting at an LGBTQ plus meeting at Indiana University, sharing insights on promoting DI in healthcare. This was presented on April 11 this year at Indiana University and sharing insight on promoting DI in healthcare education. My presenter was addressing global health disparities by integrating DI principles into undergraduate medical education. Recently, my contribution to DI were recognized with the prestigious award from ASCP in September 2024, which I'm going to receive. And this is a humbling honor, affirming my commitment to advancing DI initiatives within pathology and healthcare education.
Congratulations on being recognized by ASCP. That's amazing, and that's important work. So I'm glad that you're dedicated to that. That's great for the pathology community, the medical community as a whole. So
Thank you for
I like that a lot. So, Dr. Saxena, that it's been great catching up with you. Once again, I'm glad you were able to come back on the podcast. I know we were working on this for a little while, but and like I said, I'll link to the paper on this study in the show notes so that everybody can check it out. Appreciate your time once again, Dr. Ritcha Saxena. Thank you very much.
Thank you, and thanks for your time as well.
If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from the first time Dr. Saxena was on the show, as she tells a touching story from her career as an educator.
I have a lot of stories, but there is one in particular that I feel deeply touched by. So this was about one student of mine, a middle-aged guy. Actually, he was here, not in India. So he was a middle-aged guy with a family back home. In the career, he had left to pursue his long-lost dream, becoming a physician. During his basic sciences, he failed 2 of his courses, including mine. And he was told that his only option was to withdraw or repeat the semester. Dejected, he came to me and told me he was thinking of dropping out. And he told me about his personal issues back home, how he had a family to take care of, and he couldn't waste any more resources because he did not think he had it in him.
Uh-huh.
After a long conversation, I was somehow able to persuade him to continue on. And it was a difficult time for him, of course, and because he was, since he was a very hardworking student, he surprised everyone by doing very well in both courses, and even shells this time around, the next time. And even after passing my course, he's still in touch with me and continued coming to me for support and advice.
You can hear more from Dr. Ritcha Saxena in episode 51. All right, great big thanks to Dr. Saxena. It was really fun catching up with her. Now, as we heard, pathology education varies significantly between the United States and other countries, and this reflects differences in curricula and teaching methods. The recent study that Dr. Saxena was a part of compared the total hours spent on different forms of pathology instruction, such as lectures, team-based learning, or TBL, problem-based learning, or PBL, and other methods, revealing notable differences between medical schools in the U.S. and those outside of this country. In comparing the total hours dedicated to lectures in general and systemic pathology, it was found that medical schools outside the U.S. typically offer more hours of pathology education compared to schools within the U.S. Dr. Saxena provided examples in this episode of how PBL and TBL are implemented in pathology education. So in team-based learning, students participate in discussions and collaborative problem-solving sessions, reinforcing their understanding of pathology concepts. On the other hand, problem-based learning involves students working in small groups to analyze patient cases, interpret laboratory findings, and propose treatment plans. Both of these hands-on experiences allow students to apply their knowledge to real-world scenarios, enhancing their problem-solving skills and clinical decision-making abilities. Dr. Saxena also highlighted that these active learning strategies are particularly beneficial in high-pressure environments, such as emergency departments, operating rooms, and intensive care units. By replicating high-pressure situations in case-based learning scenarios, students can develop the skills needed to make timely and accurate decisions in critical settings. The point of all that is this: PBL and TBL in pathology education not only foster critical thinking, but also prepare students to handle complex diagnostic situations effectively, ultimately improving patient care and reducing diagnostic errors. If you want to read the study for yourself, I'll have a link in the show notes for that, as well as links to some of the other things we talked about today. Don't forget, you can follow the show on Twitter and Instagram. That's @PeopleOfPath, or you can just connect with me on LinkedIn. Thanks for continuing to share the show with others. Together, let's inspire the next generation of pathologists and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening. I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.